and Brad, the two most famous physical therapists on the internet.
All right, now we're starting. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Top 5 signs your shoulder is getting worse. I know this really seems obvious to us, Brad, because we work with this every day. But to some people, when I talk to some patients, they don't realize, that one, their shoulder is getting worse, or two, their shoulder is getting better. And
Right.
they're like, oh, it's not getting better. So then I'll ask them these questions. They'll go, oh, yeah, I guess it is getting better. And it's important to know this because you want to know that what you're doing is either helping or is it making it worse.
Right.
So you want to know that you're on the right path.
Yeah, a friend of mine talked to me a few months ago. He said, my shoulder hurts. Should I go into the doctor? It's a big question.
Yeah,
He said, I'm
that's a
not
good
sure if
question,
it's getting
yeah.
better or not. So these simple tests.
We'll touch upon those too.
There you
whether
go.
or not you should go into the doctor, what time it is. If you're new to our
Oh,
channel,
yeah.
please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free. We upload every day. Also, join us on our social media platforms. Wow, Brad is getting fancy.
You bet.
Especially official, our new Instagram. But Facebook also, because we're giving away stuff, I think, for the rest of the year. We're just going to keep giving away stuff. Right now, we're giving away a mattress.
Oh, a SleepOvation mattress.
SleepOvation mattress, our favorite mattress, and here's your chance to win one.
Right.
We're also having a sale on one.
Oh, really?
Yeah.
Say no more.
Big sale.
They are top-end mattresses. Okay, what do we say, Bob?
Number one symptom. Let's say you have pain in your shoulder. Let's say it's hurting right here.
Sure.
Let's say over time the pain starts to spread out.
Mm-hmm.
It starts going down the arm. Now it's very obvious to us it's getting worse. I mean
Right.
that's a big sign that it's getting worse.
And actually, sometimes, even if it was a sharper pain here and it feels better here, but it's starting to spread out, usually that's a bad sign.
Right. Conversely, the good sign is, let's say it was going all the way down to the hand. Now it's only going to the elbow.
Mm-hmm.
Much better. I mean, that's improvement. That's definitely improvement. And as Brad was alluding to, let's say it gets worse here, but it's not spread out as far. That's still a better sign.
Right. Unless it's really bad there. I mean, you have to use your good judgment, but if it feels like it's going to one spot, we call it centralizing, typically that's a good sign.
Yeah. Number 2, is your movement decreasing in your shoulder? So, and you can compare the two sides. You want to show how you can compare flexion first? Brad?
Right. So we're talking about flexion, lifting your arm up in the air.
Yep.
As therapists, we measure it with a goniometer, but a simple way to do it at home is you take a piece of tape like this, and you just say, this is my sore shoulder, and you reach up as far as you can until it hurts, and put that tape on the wall. And then the next day or a couple of days later, see if you can, I think, God, is it getting better or not? And let's say you can go up 6 inches taller without pain, then taller, I should say higher.
Yeah.
That's a good sign you got some improvement. Assuming, that the pain in general, maybe you don't know if it's getting better or worse.
Right. But your motion's getting worse.
If your motion's clearly getting better. On the other hand, if you don't get up to here, then it's like, well, there's a problem there where the range of motion is getting worse, the pain, and then, of course, bring this in with the location. And actually what I do is I have a chart of a body on a piece of paper. When the patient comes in, I'll shade it in where the pain is, because if I see him a week later, I usually can't remember, and usually the patient doesn't remember.
And Brad and I had this conversation. A lot of times people will come back in and I go, well, are things getting better? No, they're really not. They're staying the same. So then we'll dig down deeper inside. I was like, well, initially the pain was going all the way down. Now it's right here. Mm-hmm. And then we look at their motion. Well, your motion's better. So they are getting better. They didn't even realize it.
Right.
We have to talk them into it. So I mean, just to keep things simple, that's one measurement that you can do. The other one that you might want to do is just measure internal rotation and how far you go up your back.
Right.
So, right here, I go see how far my thumb will go up. Right here, I'm cut right kind of under the shoulder blade.
Straighten your shirt. Okay, do it again.
Yeah.
It was all covered up with material. There you go. So I will put one finger right there, and
you can compare it to the other side too to see how you're doing.
Exactly.
But you could even put a piece of tape there, or if you know where your landmarks are, like I can feel the bottom of my shoulder blade right here.
Right.
So if next time if I'm down here, I'm not even close to my shoulder blade,
Right.
or if I'm way up here, it's obviously getting better.
Right.
So
and if your shoulder's real sore, a lot of times I'll have people that they can't even get their thumb to their belt, their spine at the belt line. So that can be a guideline too if you're not way up here, because sore shoulders sometimes even here is difficult.
Sore shoulder is hard to say fast, isn't it?
Yeah,
Sore.
5 times.
Okay, next one is your shoulder weaker or getting weaker.
Sure.
So, and this is where you need somebody to help.
Right.
Like if you were to stand up, Brad, and face me.
Oh.
So if you put this is the shoulder that's giving you trouble, just pushing on it, is he able to hold resistance?
Sure.
If it just gives way, you might have a rotator cuff tear.
Sure.
The other good sign for that is put your arms like this and push them in. I'm pushing both of them in this way at the same time.
So I'm pushing out this way.
Yeah, and if one gives way, the weak one or the painful one or the shoulder problem one, then you could have a bit of a impingement or shoulder rotator cuff tear or so.
And even a more simple way to measure strength instead of manual muscle testing, and you're by yourself, simply just take a weight. Well, this is bigger than what I want.
Yeah.
Probably a 1 pound weight, and lift it up and see if you can put it into a cupboard. And if you can get 1 pound up to eye level or a cupboard at your house one day, you can tell if you're getting stronger a few days later by taking the same weight and lifting it to the exact
That's a good point, Brad.
same cupboard point.
You don't need any people around because you might be living alone. So yeah,
We keep telling people they're never going to need therapists.
That's right.
They'll be doing it all at home.
That's right. You can get rid of us.
Yeah. But Bob, what about the other range of motion as far as reaching overhead? Because with impingement.
Oh yeah, that's another good one. Yes.
Yeah, so like with your good shoulder, if I can reach way down to here, and my sore shoulder, well, if it's real short, you might not even get to your ear.
Right.
But then you go to here, and how far you go down your back is another. Yeah, you could take a marker and mark it on your skin if you wanted
Sure.
to. I don't know if I would.
Yeah, go that far. But
Yeah.
But so yeah, you got flexion, you got internal rotation, you got kind of abduction, external rotation.
Right.
So.
Right.
All right, number 4, the sign that your shoulder problem is getting worse. A lot of times you start having pain at night.
Yeah.
That means it's getting a lot of inflammation and during the day, and a lot of times that inflammation stays in there at night, and it bothers you all night long too.
Sure.
That generally is a sign that it's getting worse. Conversely, again, if it was hurting at night, now it no longer is. That's a good sign.
Right.
So these are
With the night pain, just keep in mind, if you end up sleeping on that shoulder and it's hurting as a result of laying on it for a couple hours and then you wake up sore, you got to take that into consideration.
Yeah, we've had many
as well.
conversations about that in a lot of our videos about, try not to sleep on that shoulder. If you have to, there is a way to do it.
Right.
Do we want to show that real quick or not?
Well,
The
the
canal.
canal,
we can show it real quick.
the canal system.
Do you want to grab? There's a pillow right around the other side of there.
And
Brad.
you use this canal system regularly, right?
Oh yeah, I
Bob?
do. I just woke up this morning. Do you see it, Brad? I woke up this morning, and that's exactly the position I was in. So this is in case your pain's on this side. You don't want to sleep right on the point of the shoulder.
Yeah.
So you get the 2 pillows. You get a third pillow I use just a little throw pillow.
Sure.
It's just real small. That way I create this canal here.
Wait, show them the canal.
There's the
right
canal.
There, right there.
It's the Bob and Brad canal. So you lean on this, and now the stress isn't on the shoulder like it was before. It's taken a lot of it off.
Right.
And what you can do, ideally, is sleep on the opposite side. And then in this case, again, you usually have the 2 pillows here. But in this case, you're going to want to support the arm on a pillow like this. A lot of times even 2 pillows.
Sure.
I mean, if you put it like this, and it just really keeps the arm in a nice neutral position. And it's very
but
comfortable.
he wouldn't have his head.
Yeah, I would.
Suspended.
You need 4 pillows in this instance.
Yeah, go to the store and get a bunch of pillows.
Yeah, go to my
or
pillow.
take them from your children, whatever it
That's
takes.
right. Who's more important in life?
Oh, wow.
Okay, number 5.
Oh, we got one more.
The number 5 signs. Yeah, is the frequency getting worse? The duration, meaning the length of the time you're feeling pain, or the intensity.
Right.
So usually we use the pain scale from 0 to 10. Use it in your mind. It's just subjective. 0 means there's no pain at all. 10 means you probably need to go to the emergency room.
Right, that's extreme.
Yeah, so you give it a number and then check it later. A week later, is that number going down? Are you not feeling it as often? Is it not lasting as long when you feel it? Those are all signs that it's getting better.
Right.
So, and we document those when we see a person.
Right.
So
Yep, keep track of things objectively.
that's right. And remember, Brad and I can fix just about anything
Except for
a broken heart. But But we're working on it.
We
right, Greg?
are. We'll
Yeah.
continue to strive towards excellence in all fields.
That's right. All right. Thanks for watching.